In this lecture, we're going to look at the different circulatory routes. We have the systemic circulation, the pulmonary circulation, the hepatic portal circulation, and finally the fetal circulation. Now, looking at the circulatory routes, if we go from the right ventricle is going to pump blood through the pulmonary trunk and then through the pulmonary arteries to the lungs. The lungs are going to then take up the carbon dioxide out of the blood, put oxygen back into the blood, and then through the pulmonary veins, the blood will then go back to the left atrium. Now this is our pulmonary circuit. So again, from right ventricle, through the pulmonary trunk, through the pulmonary arteries, through the pulmonary capillary bed, through the pulmonary veins, and then to the left atrium. Again, that's your pulmonary circulation. Everything else is going to be the systemic circulation. So we have branches off of the aorta that are going to go up to the head, neck, and upper limbs. That's all going to drain back into the superior vena cava. We have other branches then that go to the rest of the body, to the lower limbs, to all the organs, and those will all eventually drain into the inferior vena cava and come up back to the right atrium. Again, this is all systemic circulation. And so we're going to look at some of the major arteries of the body. And let's get a little closer look. Starting here, we have the ascending aorta, the aortic arch, the descending aorta, also called the thoracic aorta. Then once it pokes through the diaphragm, it becomes the abdominal aorta. Now going back up here, and it doesn't show it on here, but the first branches that come off of the ascending aorta are going to be the cardiac arteries, okay, your coronary arteries, those going to the heart. So the right and left coronary artery come off the ascending aorta. And then we have our brachiocephalic trunk. Notice I don't say right or left brachiocephalic trunk, and that's because we only have one brachiocephalic trunk. It's also called the brachiocephalic artery. From that, we have a branch that goes up to the head, and that's going to be the right common carotid. The right subclavian continues on from there, and coming off of that is going to be the right vertebral artery. Going to the other side, okay, we have the left common carotid artery coming off of the aortic arch, and then the left subclavian artery. And also coming off the left subclavian artery is the left vertebral artery. We're going to look at the carotids and the vertebrals a little bit later when we look at what's called the circle of Willis, and this is the blood flow to the brain. Okay, and we'll go into more detail as well what the subclavians become. Okay, so if we go down the thoracic or descending aorta, we're going to see these smaller branches. We have bronchial branches. We have some of these intercostal branches that come off. And then once we poke through the diaphragm, the first major vessel coming off is going to be the celiac trunk. The celiac trunk, think about the trunk of a tree, it's going to have branches coming off of it. Well, so does this. So the celiac trunk is going to have one vessel that goes up to the left side of the stomach, and that's the left gastric artery. Then we have a major artery here going to the spleen. So that's the splenic artery, and then another major artery going off the opposite direction to the right of the patient, and that's going to be the common hepatic artery. And we'll look at these closer a little bit later. As we come down, we have the superior mesenteric artery, Then our right and left renal arteries, which in a cadaver is a little hard to see because they're covered up by the renal veins. Going down a little bit farther, we have the right and left gonadal arteries. In the male, it'll be the testicular artery. In the female, it'll be the ovarian artery. Go down a little bit farther, we have the inferior mesenteric artery, again going to the intestines. And then the aorta is going to branch when it gets to the ileum. And so we're going to call these the iliacs. So the right and left common iliac. And these are going to branch. So we have some branches that are going to go more internally. So these are the right and left internal iliacs. Then we'll have some branches that stay external. So that's the right and left external iliac. Then when it goes under the inguinal ligament, it becomes the femoral artery. So the right and left femoral artery. One of the major branches coming off of that is going to be the deep femoral artery. Now, distribution off of the heart, again, the first branches off of the ascending aorta, here's the ascending aorta, are the right and left coronary arteries. And so off of the right coronary artery, we're going to have the marginal branch. And as it goes around to the back of the heart, we're going to have the posterior interventricular branch. And then with the left coronary artery, we're going to have the anterior interventricular branch in the front, also called the LAD, the left anterior descending artery. And then we have an artery that goes around to the back, and that's going to be the circumflex branch. Okay, so right coronary artery, marginal branch, going around to the back, posterior interventricular branch. Left coronary artery, continuing in the front, anterior interventricular branch, going around to the back, the circumflex branch. Looking at the upper limbs, we have the subclavian artery, and that subclavian artery is going to go under the clavicle. When it gets to the armpit area, it's going to become the axillary artery, then the brachial artery for arm. Remember, brachium is arm. When it gets to the antecubital fossa area, in other words, the bend of your elbow anteriorly, it's going to branch off into the radial artery on the thumb side and the ulnar artery on the little finger side. And then as we go down a little bit farther, we're going to have the deep palmar arches and the superficial palmar arches. We'll have some palmar metacarpals and then our digital arteries. Going up to the head, we have the common carotid. It's called common because, again, it's going to have branches coming off of it. If it's more superficial, if we follow it and it's just staying on the surface, that is going to be the external carotid. The branch that goes more internally is going to be the internal carotid. It's going to then go through the actually the carotid canal within the skull, and it'll become what's called part of what's called the circle of Willis. Okay, and as you can see, the superficial or external carotid is going to be more superficial and have more superficial branches like the facial artery and the temporal artery that then feeds the scalp. Okay, and as we go a little bit farther, we're going to have the right vertebral artery coming off of the subclavian here. So this vertebral artery, again, goes through the transverse foramen of the cervical vertebrae, and it becomes part of the circle of Willis, again, the arteries that feed the brain. And here's the circle of Willis. So we have the right and left vertebral arteries joining to become the basilar artery, and this basilar artery sits right on top of the pons. Remember, the pons is part of the brainstem. And then it comes up, and then we have what's called a posterior cerebral artery. We have posterior communicating arteries. And then here is our internal carotids. Okay. And then here's our anterior communicating arteries and our anterior cerebral arteries. Right here's a branch coming off. That's the middle cerebral artery. Down here are the pontine arteries. And then we have some arteries that are then going to go to the cerebellum. And so looking at the celiac trunk, and just going back here again, you can see the celiac trunk where it comes out. We have some branches off of that. The first one is the left gastric artery. Now, the stomach, it's not in its normal position in this picture. It's actually been lifted up out of the way. This should lay down on top of the pancreas. But we've just reached underneath, so this is actually the bottom portion of the stomach. We've just grabbed a hold of that, lifted it up. So here's the bottom part, here's the top part. Just moved out of the way, and you can see the left gastric artery. And then the next big vessel coming off the celiac trunk is going to be the splenic artery, because it's going to the spleen. Then the next branch off of that is going to be, off the celiac trunk, is going to be the common hepatic artery. And if you wondered if there was a right gastric artery, there is. It's right here. So the left gastric artery, the right gastric artery are going to combine. Okay. And of course you see some other arteries coming off. For us, we're just going to leave it at those major branches. And then below that, we're going to see the superior mesenteric artery. And so the superior mesenteric artery, you can see, is going to go to the right portion of the gut and also to the jejunum and some of the ileum. And if we skip the renals go to the kidneys. Skip the renals, we go down to the inferior mesenteric artery. You can see that's going to supply the left gut. Looking at this cadaver picture, we have the diaphragm. We have the abdominal aorta as it pokes through the diaphragm. We have our celiac trunk with the splenic branch and the common hepatic branch. Here's the superior mesenteric. Just underneath that is going to be the left and right renal arteries. Again, we really can't see them too well, just a little bit there, because the renal veins are coming out of the kidneys and emptying into the inferior vena cava. So here's the inferior vena cava. And then if we go down a little bit farther, we're going to see the inferior mesenteric artery, and then our right and left common iliacs, and then our right and left internal iliacs. Continuing past the internals are going to be the external iliacs. And as it goes underneath the inguinal ligament, it becomes the femoral artery. So looking at that in the graphic here, in the picture, we have again our common iliac, our internal iliac, external iliac, underneath the inguinal ligament, the femoral artery, the deep femoral artery. Now, right here, this is at the groin area, right at the bend of your thigh. This is very superficial, so you can feel a femoral pulse right here. But from here, it's going to start to dive deeper and go around to the posterior portion of the thigh. And so if we just rotate the leg around, now we're looking at the back side of the leg here. So again, here's our femoral artery coming down. On both graphics here, it's the right femoral artery. This is anterior view. We're looking at a posterior view. Now we're behind the knee. And this is the popliteal view. You can call it popliteal or popliteal. Either one is correct. And think about it this way. If you bend and your knees pop, that's how you remember the back of your knee is popliteal or popliteal, however you'd like to pronounce that. Okay, so you have the popliteal arteries. We go down, and then when we get to the tibia, it's going to be, let's see, we're going to have our posterior tibial artery right here. Okay. And let's see, it's not really showing it very well, but right here it pokes through, and this, oh yeah, I guess it is labeling it here. Right here's the anterior tibial, and you can see it pokes through to the front, and so here's the anterior tibial artery, comes down, and on the top of the foot we'll have the dorsal pedis artery. Typically, clinically, we just call it the dorsal pedal artery, and that's a good pulse point right there. And then we have the arcuate arteries, and then the digital arteries. Okay. Also, the next branch, so that first branch off the popliteal artery, anterior tibial, below that we'll have the fibular, or another name for fibular is peroneal artery. Okay, so that runs along the fibula. Okay, and then we'll have our, coming off of the posterior tibial at the foot will be the posterior, or I'm sorry, the plantar arteries, because the bottom of the foot is the plantar portion of the foot. So you have the plantar arteries and arches, and then the digitals. Now, veins typically follow along arteries. If you find an artery, you'll typically find a vein. And most veins are going to have the same name as the artery, but there's some exceptions. Like, for instance, starting at the heart, we have the anterior interventricular artery. Well, we have the great cardiac vein right there. Okay. And remember, we had one brachiocephalic trunk for an artery. Well, we have a right and a left brachiocephalic vein coming in, and that drains into the superior vena cava. So instead of having an aortic vein, we have a superior and inferior vena cava. And instead of having a carotid vein, we're going to have the jugular veins. And we're going to have the right internal jugular here and the right external jugular here. Okay, and if you notice, the internal jugular is going to be the largest of the two jugulars. Okay, the external jugular is going to drain away portions of the scalp. The internal jugular is going to drain away from the brain. And so it is much larger. Although we will drain away parts of the face as well with the external jugular. Okay, but just remember that the internal jugular. Just remember that the internal jugular is much larger. Okay, well, and if you take a look at the superficial temporal vein, you can see it draining into the internal jugular. Okay, also the facial vein is going to be draining into the internal jugular. The external jugular, however, will take care of most of the scalp. Okay. Now, we do have more superficial veins and deep veins of the arm. And let me just show you a different picture, one I like a little bit better, and that's this one here. But you can see that we have the subclavian vein, okay? And I'm going a little bit backwards because really we're draining from the fingers back and then going to the heart. But I'm going to explain this the way I would arteries, okay? But just know that it's really backwards from the way I'm explaining it, but it'll help you remember it better with this explanation. So we have our subclavian vein. Again, that drains into the brachiocephalic vein. In this case, we're talking about the right arm. So the right brachiocephalic vein is what the right subclavian is draining into. The left brachiocephalic vein, both of those come together, form a little Y, and then drain into the superior vena cava. But anyway, we have the subclavian vein. And of course, as we go under the clavicle and get near the armpit, we have the axillary vein. If we keep going, we have the brachial vein. Now this is actually going to be a deeper vein here. We have the brachial vein. And just like with the artery, it's going to split on the thumb side. We have the radial vein. On the little finger side, we have the ulnar vein. Okay, and then it's going to come down to your dorsal arch vein. Okay. Now, again, these are deeper. More superficial, we have the cephalic vein, and then medial to the arm here, we have the basilic vein. And then connecting the two from the basilic down to the cephalic vein, we have the median cubital vein. Okay. And so a lot of these veins, you want to get to know these because when you do venipunctures and start drawing some blood, start doing a little phlebotomy, you want to know these veins. Okay. So one more time here, we have the cephalic vein, which is more lateral, and then we have the basilic vein, which is more medial. Well, how in the world are you going to remember that? Okay, cephalic means toward the head. Basilic means, it's along the base. Well, you know how anatomical position is, right? With your palms facing forward and down by your sides. Well, what I want you to do is put your palms forward, put them by your side, and then bring it up out to your side. And so now, if you look at the top of your arm, your thumb is facing upward, that top part is going to be the cephalic vein. So it will be pointing up toward the head. Now, on your little finger side, that should be pointing down toward the ground. And so that's going to be the base of your arm. And so this is the basilic vein. Okay? Cephalic vein, basilic vein. So once more to recap, we go from the subclavian to the axillary. If we go straight down the center and deep, we have the brachial vein. At the elbow, it's going to split into the radial vein and the ulnar vein. And then we'll have the palmar arches. If we go back up here and go more superficial, the cephalic vein is on the thumb side. So again, holding your arm out to the side. is going to be the thumb, pointing your thumb upward. The top of your arm is going up toward your head, so that's the cephalic vein. The bottom of your arm forms the base of your arm, so that's the basilic vein right here. Okay. And then we can see in this view of the hand, because you'll be drawing blood from the hand as well, we have the right cephalic vein. We have some of the dorsal venous network of the hand. So the dorsal venous arches are in there. We have the dorsal metacarpals and the dorsal digital veins. And looking more in the thoracic and abdominal regions, again, we have the left and right brachiocephalics draining into the superior vena cava, which would then drain into the right atrium of the heart. Here's the inferior vena cava. And again, that's going to pierce the diaphragm and also hook up with the right atrium of the heart. Here's the internal jugulars. Here's the external jugulars. The subclavian veins. Okay. We also have what are called the azygous veins right here, and the hemiazygous are on the opposite side here. And then, of course, we're going to have the renal veins, and as I showed you in the cadaver picture, the renal veins sit on top of the renal arteries. Okay. And then as we come down a little bit farther, again, we're going to have the iliacs and then the femoral. Now, looking at the legs, okay, again, we have the common iliac, the internal iliac, and the external iliac veins. And then we have the femoral vein. Okay, but then this one is clinically significant. This huge long vein. This is the great saphenous vein. You can see it right here. Again, the great saphenous vein, why that's so significant is because if someone needs coronary artery bypass graft, okay, in other words, they have a blockage of their coronary arteries, then they need to bypass that blockage with some new plumbing. Well, where's that plumbing coming from? They're going to use the great saphenous vein to provide the vessel to sew usually into somewhere on the aorta, the aortic arch, or ascending aorta, and then bring it down and patch it into whichever, past the occlusion of whichever coronary artery is blocked. Okay? And so the great saphenous is used for that. And so if you think about it, once that saphenous vein is removed, I mean, that's a pretty large vein. Okay? And so there's going to be fewer veins to drain the blood away from the leg back to the iliacs and eventually back to the inferior vena cava. So the blood is going to typically start to pool, and this is why after a patient has had that bypass surgery, and if they've used the saphenous vein to do the bypass with, usually the patient's going to have to wear some type of support stocking to help compress the leg and keep the blood from pooling. So again, that's an important vein to know. Looking at the hepatic portal system, we're going to have these vessels basically that are going to drain into the hepatic portal vein and then into the liver. So basically, blood coming from the gut will go to the liver to process that blood, to detoxify it, to modify nutrients, etc. And so if we take a look at this little schematic here, we can see how it drains. So tributaries from portions of the stomach, pancreas, and portions of the large intestine will drain into the splenic vein, and this splenic vein drains into the hepatic portal vein. Now, tributaries from the small intestine and portions of the large intestine, stomach, and pancreas are going to drain into the superior mesenteric vein, and that drains into the hepatic portal vein. And this drains into the liver, again, where things are processed. Now, the hepatic veins are going to empty then into the inferior vena cava, which goes to the right side of the heart, okay, and goes to the lungs, comes back. Then blood is going to go through the aorta, and then when we reach the abdominal aorta, we have what's called the proper hepatic arteries, and those also go to the liver. Okay. The pulmonary circulation, let's take a look at this schematic. We have the right ventricle, we have the pulmonary trunk. It's going to go through the right and left pulmonary arteries, gets rid of carbon dioxide, picks up some oxygen, goes through the right and left pulmonary veins into the left atrium. So that's your pulmonary circulation. Now, fetal circulation, again, the fetus is not utilizing the lungs to get oxygen or get rid of carbon dioxide. Okay, so it's relying on the placenta. Okay, now if we take a look and start at the placenta, here's some differences here in circulation at birth compared to fetal circulation. The placenta, again, is going to provide nutrients to the fetus. It's also going to supply oxygen and get rid of carbon dioxide. So we have this big red vessel here. So what do you think that big red vessel is? Is this going to be the umbilical artery or the umbilical vein? What do you think? If you said umbilical artery, then you made the mistake I made when I was taking this class way back when. That is the umbilical vein, because remember the definition of an artery and a vein. Veins go toward the heart, arteries go away from the heart. Even though this is carrying oxygenated blood, this is an umbilical vein pumping toward the heart. Okay? So we have the umbilical vein going toward the heart, and we have this thing here that's called the ductus venosus. Okay? And that's going to dump blood into the inferior vena cava. So blood going from the superior and inferior vena cava are going to go into the right atrium. Now here's the thing. From the right atrium, blood goes into the the right ventricle, and then off to the lungs. Correct? Since the fetus is not utilizing the lungs, we need to bypass some of that blood and bypass the lungs. Okay? We don't have to send all the blood to the lungs. We're going to send some there because we want to make sure capillaries are patent and functioning and everything. And also the lung tissue itself is going to need oxygen. But we're going to bypass some of that. So one of the first bypasses is going to be from the right atrium to the left atrium, and it's going to go through a hole. Remember holes? The term for a hole is a foramen. And so this is an oval hole, so it's the foramen ovale. Okay, foramen ovale. Now, blood that does get pumped through the right ventricle up into the pulmonary trunk, well, here's another little shot at bypassing the lungs, and this is the ductus arteriosus. Okay. All right, so that's going to be found in the fetus. And then we're going to have branches of arteries that are then going to basically have some deoxygenated blood, and these are the umbilical arteries. Okay. Now, this is not a blood vessel, but we have the bladder down here, and we have this opening of the bladder called the urachus. Okay. Now, after the child is born, that urachus closes down, and that's kind of important because some people have what's called a patent urachus, which means if they put some excess pressure on the bladder, that urine can actually travel up this urachus, and you can leak urine out of your belly button. Okay, but typically that will close off and it'll become an umbilical ligament. Okay. All right, going back to this. So after birth, of course, the umbilical cord is clamped and cut, and so there's no longer an umbilical artery or umbilical vein. Okay. So what happens to the umbilical vein here is it's going to become what's called the ligamentum teres. And when we do digestive system, you will see that ligamentum teres. By the way, teres means round, but round's probably not a good description. It really means, teres means cylindrical. So like a marker. If I were in class, I would be holding up one of the dry erase markers that I would use on the board, and that shape is a teres shape. Okay, so the ligamentum teres is going to be cylindrical like that. Okay. All right, so umbilical vein becomes ligamentum teres, and then the ductus venosus becomes the ligamentum venosum. Okay. Now the foramen ovale, there's a little flap, and when there's pressure changes after birth, that little flap closes and eventually seals. That is going to become then the fossa ovalis. So it still looks like a little dent in there. It's still oval shaped, so it's the fossa ovalis. And then when we come up here to the ductus arteriosus, that is just going to fuse and become a ligament, and that's the ligamentum arteriosum. Okay? So those are the differences in fetal circulation versus circulation right after birth. And from here we can see, again, from the placenta through the umbilical veins into the ductus venosus. Umbilical veins are also going to go to the liver. The liver is also going to put blood then into the inferior vena cava, or we can go directly from the umbilical vein to the ductus venosus to the inferior vena cava. Into the right atrium, some of that blood is going to go into the right ventricle, into the pulmonary trunk, into the pulmonary, or into the lungs, the pulmonary system, the pulmonary veins, and then the left atrium. Some of that blood is going to bypass and go from the right side of the heart, the right atrium, through the foramen valve into the left atrium. By the way, we call that a right to left shunt. Okay, we're shunting blood from the right heart to the left heart. From the left atrium then, goes into the left ventricle, into the aorta. Or as blood goes into the pulmonary trunk, it can go through the ductus arteriosus into the aorta, and then into the systemic circulation. Some of that blood will return to the inferior vena cava, and some of that blood will go on into the umbilical arteries and to the placenta. Now, the development of blood vessels in blood. Blood vessels develop from isolated masses of mesenchyme in the mesoderm called blood islands. And then aging results in loss of compliance of the aorta. In other words, the aorta is not as stretchy anymore. It becomes very stiff. Reduction in cardiac muscle fiber size. Okay, so it's not going to be as strong. It's not going to contract as hard. Progressive loss of cardiac muscular strength. Again, we can start heading toward congestive heart failure. Decline in maximum heart rate. And then also an increase in systolic blood pressure, a lot of times due to plaquing of the arteries. There's more resistance there, along with that loss of compliance. That's going to cause an increase in systolic blood pressure.